Welcome to TriloTalk. This is a podcast dedicated to topics that we think are important to the profession of medical writing. And our goal is to bring topical issues to the forefront and hopefully spark conversations in the wider domain about these issues. So I'm Julia Klaproth, and I'm here today with Gretchen Griffin, and we're going to be talking about the value of medical writing. Good to have you here with me talking today, Gretchen.
Thanks for inviting me, Julia. This is very exciting and a topic that is very close to my heart.
Yeah, mine as well. I've been looking forward to doing this session because, it's funny, people talk about quality of medical writing and the value of medical writing. And it's one of those things that can be very difficult to nail down. What's a good medical writer? How do you identify a well-written document? And I think it'll be interesting just to hear your thoughts on that and explore this topic together.
I agree. It's a little bit like an amoeba in how you look at it, right? Like you don't know that you could really describe its current state, but when you see a good document and a good writer, right? Like it's very apparent. And a lot of times when people think about the value of a writer, they have an experience with somebody who has demonstrated what good or great looks like. So a lot of times it's a person that reflects that, and it's not so much the concept. And I think that's why it's really hard to qualify and quantify.
Yeah, I agree. So I want to start with an idea that comes to mind often when I think about the value of medical writing. And it's a phrase that a colleague of mine said to me once. It's pay me now or pay me later. And I love the idea of that in terms of the value of what medical writers bring to the table, because for me, it just sums up this idea. You can get a good medical writer involved at the beginning of a clinical program, or you can wait until the end and bring them in, say, for the dossier. But the difference between those two is night and day in terms of the ease of the whole program, the quality of the documents throughout, and the speed of being able to pull your dossier together at the end. And so the whole pay me now or pay me later just resonates strongly with me. If you can get somebody involved at the beginning and you set your documents up basically for success, because you have somebody right at the start of your program thinking about what is a good document. They're helping teams stay focused. They're doing all the things that a good medical writer brings to the table. You really see the value of what a medical writer has to offer.
Well, I think it's so interesting, the concept of pay me now, pay me later, right? Because when I hear that and I hear what you say, what my mind immediately goes to is having, when you get somebody in there from the start, they are carrying through the historic knowledge. They understand the vision and the road mapping for how that drug is moving through all of the clinical trials. They're able to help the team shape the messaging for the long run.
Yeah.
And it is more of a build, a proactive build, than it is a cleanup job. Right.
Yeah.
And I think that is the inherent value of having somebody carrying through the knowledge, reminding the team, right? Really being that shepherd of the message and saying, well, do we really want to do it this way? Because remember when we talked in phase 1 or phase 2, this is what we wanted the outcome to be, or looking back at the message mapping.
Yeah.
This is really what we need from this trial to get into the label. So do you really want to make that part of the protocol when you know that that's not going to get you that outcome in the label, right?
Absolutely.
You can't make that claim if you don't get this outcome.
Well, that's exactly the point. I was talking recently to a group about what medical writers bring to protocol writing, which is at the very beginning of your program, right? And I was saying, well, one of the key things is that if I'm writing a protocol, I start by thinking, okay, what am I going to do with this information in the CSR? And out of that, I already start thinking, and what am I going to do with that piece of information in the dossier? How is that actually going to ultimately support what I'm going to have to defend in the label? Does it even support it? Do we need it? Because if it doesn't support what's in the label, why are we collecting it? And I've had conversations with teams about, okay, tell me what you think we're going to say about this in the study report. Can you tell me? And sometimes they just go, well, we don't really know what we would say about it. And then I challenge them and say, well, so do we need to collect it? Couldn't we make this study simpler? Avoid potentially needing an amendment at some point because of all the complexity. Get rid of all the things that aren't going to take you to your goal, your regulatory goal at the end of the day, not some academic goal, but getting this drug approved. So it's all about that long-term insight and foresight.
Yeah. And I think that kind of dovetails onto another part of the value of a medical writer being involved early, is that we're always looking at increasing efficiencies, but we often pinpoint process, right?
Yeah.
But really, if you think about it, one of the easiest ways of making things more efficient is always staying true to what your original intent is, and having that person really remind the team and make sure that you're being efficient when you're planning the protocols, and then when you're messaging, the outcomes. I think that's really important, because a lot of times in thinking about this topic, I thought back to a lot of my experience, and it reminded me of a pirate's map, right? Like running around in circles trying to find the X. Nobody knows where the treasure is buried. So you take forever, and it takes way too long, and you go down the rabbit hole and dig a lot of holes, and there's nothing there, right? But really, if you had somebody guiding the process and reminding the team, we already dug here. Right. Or we were just in this area, we found nothing.
We had this conversation already.
Exactly. So, and there's often turnover in companies, so you're dealing with different clinical trial teams and PIs and, med leads and things like that. And that knowledge does not get held over. Yeah. So yeah. I think that's a really key point, in that a medical writer that's there for the long term is really worth their weight in gold.
Yeah, well, they're kind of a holder of the legacy knowledge to a large extent. I love this idea of the pirate's map, though. I mean, just a roadmap in general. I think that just makes me think of another area that writers bring value, and that's in understanding the documents, understanding the needs of the documents from a regulatory perspective, the ICH guidelines that are saying we want to have this and this and this, because the clinicians understand the disease, the statisticians understand the analyses, and they bring a bunch of ideas to the table. But the writer is a stakeholder in their own right on that team, because they come in and they're able to explain, or they should be able to explain, what goes where, why you want to put this information in this section as opposed to that section, and how those sections relate to each other, so they don't get redundancies or inconsistencies. And you need to have somebody on the team who understands how to structure the documents in a way that really makes it user-friendly, keeping in mind that user-friendly doesn't mean writing a novel, right? Because you're not writing a book that somebody reads from front to back. You're presenting a tool that's going to be used by a reviewer at some point, whether it's the investigator at the site or a reviewer at an agency who wants to go in and find specific bits of information for their purpose. And so you need to know how to set up a document that empowers people to do that, enables them to get in and find that information. And when they get there, I mean, the classic one for me is the dosing. It's one of my favorite pet peeves in new programs. When I come in, the first thing I do is go in and try and understand the dosing. And I am amazed how often there isn't one place in a protocol or a CSR that clearly and succinctly says how much they got, when it was given, and that type of information. There's a piece of it over here. There's a piece of it in another chapter. There's a piece of it in the introduction. And you're thinking, oh my gosh, I'm back to the pirates map trying to figure out just what the people were given. And if you understand when you're building a document, how to pull information together into one nice place to help the reader, then it makes a huge difference in the usability and the reviewer friendliness at the end when it goes to the agencies.
Absolutely. And I think medical writers' understanding of those documents is so important, like you stated, and they must be fit for purpose, right? Not only who is looking at them, who's your audience, right? And the protocols are so interesting in that way, right? Like CSRs, you know that a lot of it's going to be the agency that are looking at it. And also now when you're posting clinical trial disclosure, which is a totally different animal, right? But particularly your protocols, it's, your agencies, right? Because they've got to review them and clear them. And if you've got any ethics committees that are looking at it as well, right? So they have to be able to understand it so they can review it and okay that too. Mm-hmm. But also what a lot of people don't think about in writing is how are the clinics and the hospitals getting that information, right? That when I was involved with protocols, one of the things that always trip people up were the schedule of assessments and the text versus the table. And well, how does the clinic use it? They don't look at the text a lot of times. They pull out that table, laminate it and stick it on the wall or punch holes in it and put it in the book. You cannot have 80 million footnotes on that table to have them make sense of it because that's not user friendly. That's not fit for purpose. Yeah. And I think having a writer going in that has that broad spectrum knowledge of what is this document, what needs to be here, how do I make it right for the reviewer, the end, the user, utilizer. Exactly. Right? How do I make this work for them in a meaningful way? That's the value of a writer in that sense.
Yeah, I totally agree with you. Totally agree. Okay, so I'd like to jump to another area that I think is really important. It's probably at least 50% of the value that a medical writer brings, and that is their value in the team dynamics. So the sanity and the cohesion that they can and should bring to the myriad of stakeholders that they're working with.
Yeah. So for me, this is the difference between a good writer and a great writer. Yeah. And what you have in a writer when this person walks in, sits down, and you feel that balance of competence and confidence. Yeah. Right. Yeah. And they really are in it for team dynamics, right? They know how to manage the team. They know how to be that calm in the center of the storm. Mm-hmm. And really manage personalities. They have their own self-awareness and how they manage themselves, but then also that external identification of what's going on in the room. How are people behaving? Like, is this something that we need to take offline to minimize the impact of what's going on in the team? So I think really having that person who's very comfortable with the content is great, but knowing that we are never working in isolation, it is always with the team, and we need to learn to be part of that.
Absolutely. You have to have the wherewithal to understand your role in that team and to understand that many times you're the center of the vortex, right? You're the one holding it all together. And the difference between success and failure is your ability to understand the power dynamics in the group, to recognize, does this group even have a leader? Is there an alpha? Are there 5 alphas? Are there just a bunch of betas? And being able to adjust, being the chameleon to know there are no alphas on this team. I'm going to have to step up. Or maybe there's just one good alpha. They've got it all under control, and that's great. And you can sit back and work with that person, but you have to be able to read it and know, what level of leadership am I going to have to take in this crowd? And then I think it has to do with how you communicate with the team, the confidence that you bring in choosing the battles that you pick and the conversations you have about the content. When you said, as you walk in a room, sometimes when you're working with a new team, it takes a while for them to understand the value that you're bringing to the team because they don't know who you are. They haven't seen what you're going to produce. But it should unfold such that as they see the quality of the first draft that they get, and as they interact with you in the stakeholder meetings and they see the types of questions that you bring to the table, that respect grows and they begin to relax because they can trust in what you're going to give them. They can trust the quality of the document. And they know this person's got it all in control. They're going to catch it if I drop the ball. And that's the type of relationship that a good medical writer is trying to establish with their teams.
Absolutely. I think, and here's another example that feeds onto the pay me now, pay me later. Why is it important to get a medical writer involved early? So those relationships are already built in time for you to leverage them when you need them, right? And if you already know your writer, you've built the relationship, you've built the trust, then when push comes to shove and the timelines get tight and things get tense, you already have an understanding of your own relational dynamics with that person. You know that I need to deal with this person one-to-one. These people have a different key stakeholder. So I know that, I either need to get the key stakeholder's ear to get my decision points made, because these people don't have that decision-making power. So really making sure that trust and relationship is built before you need to leverage it is so important.
It's a really good point. Really good point. Yeah.
Another part of that is, yes, the medical writer is absolutely a subject matter expert unto themselves, right? We come to the table knowing a lot of things that many other people don't know, or they know little bits and pieces, but we've got the puzzle.
Yeah.
Right. And one of the things that we really need to excel in is influencing without authority, right? We are very infrequently decision makers. We don't get to unilaterally make a call on something. We do have to get all of these cross-functional acknowledgments and agreements in place, right? So we tend to be more coordinators or choreographers.
Advisors. I like to see myself as an advisor to my team. Yeah, I'm not the one who makes the ultimate decision. I get that. And in fact, I don't even want to. But I do see myself as an advisor, as a consultant. I'm there to help my team understand the implications of the choices they're making and how I can help them, right? What we need to be thinking about. And I'm going to be absolutely open and blunt sometimes about that if I need to be, to make them aware. And then they can choose what they need to do with it. But we are definitely there as advisors.
I agree. And that's where we bring our expertise to bear.
Exactly.
Right. And that's because, okay, so we don't have the MD, behind our name. So we're not that type of doctor. Yep. We don't necessarily have the the biostatistics background. Some of us do. Some writers are incredibly skilled in biostats, and my hat is off to them. But, you know, we do come with our own skill set from a technical perspective. And, you know, that's where we excel.
Not only technical and interpersonal.
Right.
It's
right.
both. It's two bucket skill set, because, and I'm just pointing that out because having that interpersonal skill set is 50% of what we bring. It's the technical, it's understanding the documents, but it's also being able to handle the teams.
Right.
And that's such a soft skill, but that's why I'm emphasizing it, because I think a lot of teams, they only think in terms of the technical, you know, the MD, the statistician, but that soft skill, they often don't have those skills. Almost even the leader doesn't have it.
But I think that's what makes you a good team member, right? Like you can be a subject matter expert and people just say they are excellent at this,
Okay.
or they know the data.
Okay.
But what we bring is a well-rounded approach to things where we bring in our technical side.
Yes.
But the great medical writer will bring in that interpersonal, that partnering perspective. That's like, you know what, this might be painful, but we're going to lock arms and we're just going to go and we're going to bring this home together.
Right. Exactly. One other thing I wanted to bring in that I think is so important, review processes. Because it's this whole area that only happens every now and then, but when it happens, it's another, you know, make it or fail type situation. And I know if you can go in and teach your teams at the beginning what a good review process looks like and help them understand what you need from them, that's the first step, because then the things you get during a review are so much more meaningful. You know, the whole difference between getting a review back where it says no at the top of the page, as opposed to maybe a sentence that tells you what they didn't like and what they might want changed, you know, helping people understand that actually they're not there to find the spelling mistakes. They're statisticians. What you need them to do is find the mistakes in the analytical thinking. And yet, how many people have no idea that that's what they're supposed to be doing because nobody's told them? I give trainings frequently to teams on this, and they come out and they go, I wish somebody had told me that 20 years ago. So one aspect of the review, which the medical writer is ultimately left responsible for, is teaching people how to do it well. The other one is then how to handle the process of going through the feedback that you get and running efficient comment resolution meetings. And I think that's another area that a good experienced medical writer really seriously brings their value to bear.
Yeah, I agree. I mean, I think you brought it up before. We're really advisors, and that's where our strength is. Well, as advisors, when you start out in anything, you set expectations. So why should, you know, document development be any different? And, you know, the first step is always training and preparation, right? So here's a kick. We always have kickoff meetings, right? We've got meetings upon meetings upon meetings. We need to make the best use of that time. And part of that is really training, like at reviews.
Yeah.
Here are the boundaries. This is what I need you to do. Here's what I'm going to do. This is what you expect me to do. This is what I expect you to do, right? I mean, at the core, medical writing is about communication.
Exactly.
So why should this be any different, right? It's just a different avenue of communication, right? But if we don't set the expectations from the outset, then we can't really be upset when people don't deliver what we need them to get to that efficient comment reconciliation meeting. You will have those comments that say, why? Or what's this? Or my favorite one is like 3 question marks in a row in a comment bubble. I'm like, what do I do with this?
I know.
Are we
Which part do
questioning
you
why
understand?
we're here?
Yeah, exactly.
So I really think that making sure that everybody has a set of expectations, that we go into these things prepared and knowing, what the timelines are, what templates we're using, what I expect to see on the page, and then what good looks like for them.
For them, exactly.
Yeah, I don't want to see 50 comments that talk about grammar and spacing and things like that. I would rather, more is not more. Like a good review is not, measured by the number of comments you give back or the number of track changes that appear on the page. It is about the value that is in the comment. Does this get us to goal?
Yeah. And my experience has been when I've given these trainings is that for many people, it's actually liberating for them to hear, oh my gosh, you mean you don't want me looking at that? All I need to do is go in and look at the medical content? Really? And they come out feeling like, validated in a way, like I don't have to worry about that. But I do believe that there's 2 big issues. One is, again, having established the trust. They need to trust that those things will be taken care of. And then they can relax and not worry about pointing out all the commas or spelling mistakes or formatting or whatever. But they're only going to feel like they can do that if they can trust that it will be taken care of. And I think the other point about this is it goes back to building a team, right? I'm here to help you understand what your role is so that we can function better together. I'm going to help you understand how to do a good review because I'm here to help you. I'm not here to shoot you down because you said stupid things in the document. I'm here to hopefully help you avoid doing that so that when we get to looking at what you've given us good things and we can all move through it efficiently, right? So it's about the mindset toward why we're doing this and what we're trying to achieve. We're trying to achieve a team that is all fully aligned in roles and responsibilities that can work together as a well-oiled machine, basically.
I totally agree. And the less stressful the process and the more cohesive the team feels like at the beginning,
yeah,
or at the end, the better the process is, because it's not necessarily about getting a document out the door. It's about coming out on the other side with the team intact and not leaving bodies in the wake.
Yeah, absolutely. Absolutely. Well, Gretchen, I think we've pretty much hit all the points I can think of about the value of a medical writer. It's been a pleasure talking to you today about this. And
thank you for inviting me on. I love a good value proposition for what we do.
Me too. Okay, it's been good talking to you.
Yep. Have a wonderful day.
You too. Take care, Gretchen. So thank you for listening to TriloTalk today. If you enjoyed it, please come back and listen to us again. We are planning to bring out new editions about once a month, and upcoming topics will include apprenticing medical writers, lay summaries, and how to tame CTD dossiers. You can find these episodes of the TriloTalk podcast on Apple Podcast, Google Podcasts, and at trilogywriting.com/TriloTalk.